News, the CNMI is reporting more cases as contact tracing continues in its biggest spike yet in the course of the pandemic. And we learned at the very beginning that it was schools involved, and as we reported, Governor Torres took swift action to close schools and colleges for the next 10 days. And because of that, now we are joined with the Acting Commissioner of Education for the public school system, Mr. Eric Magofna. Mr. Magofna, thanks for joining us. How are you this morning?
Good morning, Tom. I'm good. How are you guys?
Great, doing great. Just had some great 3 squares of food for breakfast, so can't be better. But wanted to switch gears a little bit and ask you for the latest on the COVID-19 outbreak. We know that yesterday the CNMI, Commonwealth Healthcare Corporation, and the COVID-19 Task Force informed us that the 2 clusters involved 1 employee at a middle school and 1 student at a middle school. So what's the latest status update on that?
So right now, the current, there are 28 active cases. That's the latest information that we got from the COVID Task Force and CHCC. I have been reaching out to the COVID Task Force to get more information. According to the chairman of the task force, he will be setting up a meeting for PSS and the CHCC and the COVID Task Force to provide updates to PSS so that we can plan accordingly.
And we know that Friday, right, was when the notice was given that all schools will be closed for 10 days. Are you expected to open next Monday, I believe, would be the 10th day?
So it's right now it's a working schedule. We're hoping that we get more information from the COVID task force, so that way we can make a decision on whether or not to open on time as the directive stated, or if need be, maybe possibly extend the school closure.
And we see all the notices online about the distribution, both for device and materials, also distribution of food. Can you give us an update on the distribution ongoing? Because this is impacting the entire Marianas, also Rota and Tinian, even though there are no reported cases there just yet, right?
Yes, so PSS, we've had a plan ever since the COVID hit the CNMI. We've been working closely with all our stakeholders, all our school principals, our leadership team, and also in collaboration with the COVID task force. And so because we're in the 2nd year of COVID in the CNMI, last year PSS did roll out the online education. And this year, because we've already established our online education platform for PSS, we knew that in the event that something like this were to happen again, we could smoothly transition back into an online to ensure that our students continue to receive the instructions that they need in order to ensure that the learning loss that there's some kind of mitigation for learning loss with our students.
And so the public school system. Sorry, go ahead.
So with that, the schools have been distributing all the devices to the students. So at our secondary level, our students already have all their devices that they need. Right now, it's the elementary school that will continue to distribute devices, whether it be iPads, laptops, MiFi devices, and hopefully get all of that out today so that they can move directly into the online learning.
And there are about over 9,000 students right across the CNMI public school system. What protocols are in place? Because as we learned yesterday, these cases were identified through routine school-based testing. So we know that there's that school-based testing in place. Can you explain the protocols and maybe also in relation to how the initial cases were identified?
Yeah, so PSS in collaboration with the CHCC, this school year, CHCC and PSS worked together to set up a antigen screening schedule. So what this is every quarter, students that register or parents that register their students to receive the antigen testing will get tested in schools. And I'm pretty sure you're well aware of the antigen testing and how it's conducted. It's a less invasive test, so parents feel more comfortable with this test being administered to their child. So, and this is a way for the CNMI PSS and also the COVID task force to gauge to get data on the COVID-19 cases in the CNMI. So our first round of antigen screening, there were no identified positives. Unfortunately, this second round for the second quarter, we did have a positive case.
And one thing that I found interesting yesterday that CNMI Governor Torres mentioned was that moving ahead, there may be some plans for possible student cases that are identified positive if schools are to return to face learning. That the next time a positive case comes around, instead of shutting down the entire school system, you might just shut down that school or that classroom. Looking ahead and given that the 10-day countdown is beginning in terms of whether or not students and parents can expect to return to the classroom, can you comment on that? What are some potential plans in the works in terms of addressing future positive cases?
Yes, so I know that the conversation has begun. We met with the governor and the CHCC task force over the weekend, and this was one of the topics discussed. We have not finalized the plans yet. We're still in communications with the task force and the governor's office, but we just want to ensure that PSS, we will take all the recommendations that CHCC and the task force has to offer, because they are the health professionals in the CNMI. They handle the public health, but we will make sure that the plans are aligned with PSS's goals also of ensuring the health and safety of all our students. And yes, so with that also, PSS, we do continue to have our COVID guidelines in place with PSS. We have our social distancing, the 3W, social distancing, wash your hands, wearing face masks. We have the temperature checks, before you get on the bus and before you get on campus. We have health monitors that are all around, ensuring that the COVID protocols are in place. We have a lot. We have we have a lot of a COVID mitigation plan in place.
And I know we've been talking about students. What about employees? What are things being done in terms of the employee side of this operation? I know are they still starting to conduct their classes on campus, but virtually? What's it like being an employee right now?
So PSS, we understand that every employee has special circumstances, and we, as much as possible, we like to be very flexible with our staff to accommodate whatever their needs may be. So having said that, if a teacher needs to, because it's online learning, you don't have to be in the classroom to do online learning. You can work remotely from home. So if teachers right now, if they're not feeling, if they're feeling anxiety or whatever reason, the principals do have that flexibility to work with their teachers and staff to make those accommodations.
And what are you hearing from parents, Acting Commissioner? I can't imagine that it's been an easy time these past few days for you at the public school system. Are parents very concerned, or are you seeing that people want to get back to in person as soon as possible?
Well, naturally, every parent would be concerned, and of course, we are getting all the phone calls and all the questions. We just ask our parents to please work with us as soon as information is made available to PSS. We will disseminate that information, and we also want to ensure our parents that health and safety remain our top priority. And right now, PSS, as soon as we close down the schools, we have all our schools being deep cleaned and sanitized and COVID sprayed, and we're doing a lot of cleaning to ensure that when we do open schools, that all our facilities are sanitized and prepared for that.
And Acting Commissioner, I did want to touch on lastly on vaccinations and obviously the teenagers and youth that are might be eligible. We know that one of the campuses, Marianas High School, was recently praised for having an over 80% vaccination rate on its campus. And we're expected to hear any moment now this week from the CDC to approve or provide the recommendations for vaccination for people aged 5 to 11. What's the current status on vaccination on campuses and your plans moving ahead as the acting commissioner if the CDC is going to move forward with their plans for the 5 to 11 age group?
So the current vaccination rate for PSS, we do have several schools that have hit the 80% mark. All our all our PSS staff have hit the 80%. So PSS right now, our staff, we are about 90% vaccinated. And I did hear about the 5 to 11 to be included in the vaccination. And if this is the case and the CDC approves it and our local health department adopts it, then of course, in collaboration with them, we will do our part to help out the CNMI.
Are there any mandates, whether at the employee level or the student level, when it comes to masks or vaccines? I know there's the 3 W's, right, is what everyone is saying, has been saying for the past 2 years. Are there any particular mandates that are in place?
So with regards to vaccination, there are no mandates, but with the COVID protocols and safety guidelines, they are a mandate. So every employee, every school must adhere to the COVID guidelines, the safety protocols. So the mask wearing, the social distancing, the temperature checks, all of that is being adhered to at all our PSS facilities.
And I also did want to ask you if you had anything else you wanted to share with regards to just with schools expected to reopen in the coming days. Is there any latest on that you want to provide?
So to the parents and to all our stakeholders, as soon as we get information and as soon as there is a plan, we will share that information with all our parents. Please trust that PSS, the health and safety of your child still remains our top priority. If any parent needs assistance during this time that the schools are closed, please reach out to PSS, please reach out to your schools. We have mental health professionals on standby if anybody needs social emotional counseling or any type of support. PSS, we are ready to assist in that, and whatever concerns, please share them with us so that we can make sure that we address it and make our plans, that we have the proper plans moving forward.
All right, thank you so much, Acting Commissioner. I know you have to get to a meeting at 9 o'clock. We appreciate you making time in your schedule to inform our viewers and many of those in the CNMI with the latest at the public school system. Wishing you well, and please let us know if there's any information you'd like to get out.
Yes, thank you, Matt, thank you.
Thank you, Mr. Magofna.
Thank you, Tom. Thank you, Chris. Thank you, Mr. Salas. Thank you, KUAM.
All right, I don't know if Tom gave you the mailing address. If you want to go ahead and send that a piggy over.
I gotta try that marshmallow peanut butter sandwich.
Hey,
The fluffer butter.
hey, there we go.
He was listening. Yeah.
Thanks. There you go.
Algamas.
That's
Right,
that. There
thank you
go.
so much.
Good job, Tom.
Yeah, and again, just wanted to report on the latest. Last night, we know that of the most recent cases identified, fully vaccinated, 19 of them, 70%, unvaccinated, 2 of them, 8%, ineligible, 6 of them, 22%. Of course, a lot of these falling between the 19 to 49 age range. And we'll continue to have the latest. Yesterday was the first time after 3 or 4 days of the outbreak being identified that we got some data on that. And we know now that at least the earliest case goes back to October 7th. And so they're going to do contact tracing. And that's what that involves, is going all the way back. And as they were saying, people's memories are starting to be challenged in terms of who they've seen and I did ask if there's any threat to Rhoda and Tinian. They said no. That's a question they ask. Have you traveled? Obviously, we know that there's been events and people have been flying between Rhoda and Tinian. And so we'll have the latest on that. And when we release the daily COVID reports, we don't necessarily get this type of breakdown each time. And so when they do a data drop like this, we always want to make sure we share it out as quickly as possible.
Yeah, so if you're saying that one of the positive cases was traced back to October 7th,
yes, that's what we learned yesterday.
are we
October 7th.
anticipating? So just give me an idea, where are we at with the contact tracing? Are they still doing a lot of testing?
They are. As of October 28th, last we heard, they did over 2,500 tests, and of that came these cases. And so they're saying that it's a low transmission rate. And what we're hearing from other folks who are in these offices and schools who are reaching out to us is that it seems to be an isolated case. But then again, you can't really come to that real conclusion until the contact tracing is fully conducted. So, I mean, October 7th is different from October 28th.
That's
right?
a lot of room for transmission. But how's the community feeling, Tomas? Because, CNMI, I mean, hundreds of days without a community transmission. And when I look at what they're doing in the CNMI, it looks pretty normal. So is there a sense of like this is
no mask mandate,
precarious?
right?
I mean,
no mask mandate. They are at over, I think, 84% vaccination rate.
Wow.
The reporters yesterday, including myself, were asking exactly that question. Was that with low community transmission in the past, over 200 days, what is it like? And one thing that the chair, Warren Villagomez, told us is that moving forward, it needs to be more of a holistic approach to what he said is make it a win-win. Ask ourselves, as those in the community, are our loved ones vaccinated? And he says if they're not, convince them to get vaccinated. And I did ask them about the index case, right? If we have seen no community transmission over 200 days, was this case identified through quarantine, or has there been community transmission? In fact, you only know what you look for, and in this case, it will be increased testing and increased vaccinations. The boosters are available, and the school-based testing continues to be in play. And I think you have to give it up to the public school system, because if they didn't do that school-based testing, you wouldn't have identified those cases, right? So they are all hands on deck. They're having an aggressive approach to stomping down this COVID-19 outbreak.
Have there been any restrictions implemented?
Not at the moment, though. The 3 W's, watch your distance, wash your hands, wear your mask. That continues to be said every day. And we'll continue to see each day that goes by. We know that the contact tracers are working until midnight or 1 a.m. every day. So we'll continue to bring you the latest as we know it.
All right. Thank you very much, Tomas Magofna. It's 8:57. We're back with Dr. Michael next right here on The Link. Good morning.
This year, Giving Tuesday falls on November 30th.
And though our community is still facing some of the most challenging of times, there's no better time
to volunteer, donate, spread awareness, and do whatever you can to help those